certainly reckless of you. Let me look at that. Let me look at that. Well, let's move away from the pigs. Let's come over here. No, that's not a euphemism. I saw what happened. I saw that. She dropped her bracelet and you just went right into the pig pen after her. No, some of those swine can be very aggressive. Your poor hand. Well, yeah, as you know, I'm Jen. I'm a licensed physician. And I guess today we're going to be talking about pig bites, since you have one. Of course. Of course, everything that we do stays in this safe space, right? Because you and I have not, we don't have a patient-doctor relationship out there, and, this is our secret world. Yeah. So, but let me take a look at that wound. Oh my goodness. Well, let me get some gloves on, and let's clean that up. Wow. One glove. Two gloves. Yeah, let's see. I don't know why one fits better than the other. They should be the same size. Alright, well, let me take a look at that arm. Well, so pigs do have nasty bites. So pigs carry a lot of diseases, but pig bites are more like dog bites, cat bites, human bites, in the sense, in some of the kind of bugs, the bugs that can be carried. Let me just take a look at your arm here. Does that hurt? Can you go ahead and, just looking at your fingers here, can you flex, flex your, can you squeeze my fingers? Okay. You didn't hear crunch. I'm just palpating here for crepitus. What I'm looking for, crepitus is like where there's a, like, crunchy bubbling underneath the skin. Usually that's what happens if there's like a fracture or something like that. It didn't bite your finger, right? So it's pretty solidly in the forearm, so I'm not really worried about a break, but we'll always check. The forearm wounds bleed a lot. Make sure that you didn't have any. Here, I'm just gonna kind of keep this on it. Yeah, go ahead and hold a pressure on that. Hold pressure. That's good. Let me get something out of my doctor bag here. Keep holding pressure on that little space there. It is still bleeding a bit, but it doesn't look like it's bleeding as much as, it's a pretty significant gash, but alright, we gotta stop the bleeding first, and we're gonna clean it up, and then we're gonna talk about antibiotic therapy, okay? So you just hold pressure right there. Don't worry about it, you are gonna be okay. Yes, definitely. Pain is something that we can address. Of course. Here, I have some rolled gauze right here. Absolutely. So let me just open this up. Get this out. And then just unroll it here. Okay, and then I'm just going to put the box back and just wrap. I'm actually just going to stuff into the wound. Okay? Stuff, and then we're going to wrap. You don't need a tourniquet. The bleeding looks to be controllable. It doesn't look like you've got, oozing, seeping, gushing. So, but we will actually, I am going to drop a little bit of Celux on it because it is a decent amount of blood. This is that's what we call a hemostatic agent. Here, I'll show you. a hemostatic agent. I'll just go ahead and open this, and then sprinkle it into the wound. That's perfect. Okay. Well, yeah, as you can see, I'm lifting up the gauze to get this under it, and then we're going to pack more gauze up on top of it. Just kind of wrap the gauze, wrap the gauze, wrap the gauze. And we're going to cover, 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 cover. Keep wrapping. And then I need you to hold pressure real firm on that. Perfect. Very well done. Yeah, just keep holding pressure. And we're going to hold pressure for 5 minutes. Yep. So you just keep holding pressure. Yep. Well, ideally, so I saw that you flushed it out with water on your way over here. That was a good move. That was the right thing to do. If you hadn't flushed it out with water and there was like a lot of debris in it, I would want to really quick try to flush it before we put the Celox on it. That's one of the reasons that Celox is not, so like in like a war fighting scenario, I would want to put, for a lot of blood, I'd want to put a tourniquet on first. For something that's not a lot of blood like that, I would want to, but that's still, significant, I'd want to stuff it with this other gauze first. You don't have time when you're right in the middle of an action scenario to like spend a lot of time cleaning, right? Especially because you don't want to be flushing out wounds that, you need to keep that blood in the body as much as possible. So, so you don't want to spend a lot of time doing that. But for something like this, it's good to wash it first, and then it was still oozing, obviously, a significant amount, is why we didn't waste the Celox, but that's why we used the Celox on there and the gauze. So you kind of have to adapt to the scenario. You don't really want to cover up a dirty wound, because then you can get infected. That's also why nowadays, so actually I don't want to stitch that. That is a pretty decent wound. But I don't want to stitch that because there's a high probability that it'll be infected. If you stitch it up, you're closing all the dirt in there. So even though you washed it out, stitches is actually not a good idea. The times that I would do stitches, really there's two. There was a surgeon that I used to work with, IRL, who basically taught me, basically said there's really two reasons to give stitches. One is going to be for cosmetic effect. So like if it's somewhere where like a big scar on the face is going to be a problem, or like where there's going to be difficulty approximating. So like over a tight muscle group, like here, where this moves a lot, I actually might throw on a couple interrupted stitches to get the wound to close so it's not just open. As it's healing, you can get, so that you get a nice approximation. But basically, the big concern is always going to be infection. The second reason is going to be that you would do stitches is going to be for bleeding. Like if you just really need to control bleeding, because it's just not going to stop. So like hemostatic control. And that's what I'm talking about. Like if it's going to keep popping open because it stretches and moves, like on the arm, and then you can keep having bleeding, that's not very great. Here on like the deltoids, that's where I would put in a couple interrupted stitches to keep the wound closed so that it has a chance to heal, right? And you don't have that just random bleeding. But here in kind of where you have it on your forearm, like right there in the musculature, you're going to be, even though that seems like a big gash, you don't want to close in anything in there. So I would leave that alone, and we're just going to pack it and wrap it real tight. So just keep holding pressure. It hasn't quite been 5 minutes yet. It's just been a couple minutes. So, but it looks like that did the trick. And then we'll just keep wrapping it and we'll tighten it up. Now you don't want a tourniquet. Tourniquets are exquisitely painful. If it's not painful, then it's not working. gets it completely shuts off pulse into the area. So a tourniquet shouldn't even be on for, like, tourniquets, first off, have to be only removed by personnel who know what they're doing and are ready to deal with massive hemorrhage. And so there's that issue. And tourniquets, when applied, after a certain period of time, there actually ends up being tissue damage downstream. You don't want a tourniquet if you don't need one. Again, like I mentioned, for like wartime injuries, right away, you grab, you always put a tourniquet on, like an area of, when there's a ton of bleeding, because most of the time, as a gunshot wound, it could significantly bleed out. So those are things that we worry about. Yeah. Well, that makes sense. Yeah, I'm just watching it. Well, if you're interested in learning about that kind of stuff, the Deployment Medicine app is free, and they use all the most recent evidence-based studies and guidelines to update regularly. The main guidelines you want to read through first are the TC3 guidelines, basically the trauma, combat, casualty care guidelines. Yeah. So, for your pig bite, we're going to give you Augmentin. You are not a tiny person, so we don't have to dose you pediatrically. The pediatric dosage is going to be 25 milligrams per kilogram twice a day. But are you okay there? What are you doing with it? Just hold pressure on it. Don't do weird stuff to it. Well, don't get lazy about holding pressure. It is almost 5 minutes. It's not quite 5 minutes yet. You gotta keep holding pressure, okay? So as I was saying, 25 milligrams per kilogram twice a day. Hold on, let me push on it. You can lift up your arm there. Okay? Okay. Do this. I know, it's so uncomfortable. Okay. Alright. In you, the dose is going to be 875 milligrams twice a day. So Augmentin is, that's actually a question that I should be asking you. Do you have any penicillin allergies? No? Okay, good. Augmentin is amoxicillin with clavulanate together. The clavulanate basically, you can think of it as like the thing that bores a hole in the bacteria so the amoxicillin can get in. It's basically a weapon to help the amoxicillin and make it stronger. So those things go well together. And yeah, that's a penicillin derivative. If you weren't able to have Augmentin, that's a good question. I would probably then default to not a doxycycline. I think that's a little bit of overkill, or not quite right. But I would keep that in the back of my mind. You don't want to be helping promote doxycycline resistance, and it's one of my favorite drugs that I use for pretty much everything. So I would start with another good like cellulitis treatment, basically. I would keep Bactrim in my mind. There's always the risk there of sulfa allergies. Yes, that's right, the one that begins with a C. Do you remember what it is? It's the 4 times a day medication, right? Well, now I'm not going to give you the answer. Now you're going to have to look it up. Well, you want to be a good medic, don't you? So 4 times a day medication, that's good for cellulitis, that begins with a C. That's okay, you don't have to remember everything in the whole world. It's clindamycin. Yep, that's what I would use. That would be my backup. But again, that's like 4 times a day. I know that that's a lot, and not everybody wants to be taking something 4 times a day. So, That's for 4 times a day for most cellulitis, right? For pig bites, you can do 3 times a day, 450 milligrams per dose. Yeah. All right, you can stop holding pressure. I'm going to wrap it up a little more. It does look like, take your hand off for a second. We're not oozing. It does look good. I'm happy with it. I'm going to wrap this up a little more. So you're going to want to follow up on that. I would say, so I mean, we're packing it really well. I think you need to follow up with your primary care physician, and look at getting the good things out, getting all that out, repacking the wound, rebandaging. So you want to follow up with them. Can you get stitches after the fact? So it's also not a good idea to it's not a good idea to stitch an older wound. Is the worst of the stitchings, because the older it is, the more likely that there is a like bacteria has been around the area and so forth. So no, you definitely want to let it heal. But yes, all that stuff being in it, you do want to clean it out, since we did put the Celox and everything else. But don't mess with it now. Give it a couple days, and then get your appointment. But I would change your wound dressing. Yes. What do you mean? I'm not sure I understand the question. Well, here, I can send a message to your primary care physician right here. I have my laptop with me at all times. Yeah, absolutely. I can just send them a message. Yeah, absolutely. Yeah, I can do that. You can get them the data. What were you doing? I saw you jump into the pig pen to get her stuff. That was very nice of you. Yeah. Oh, that's a good question. That's an excellent question. Let me just finish this note to your physician. Let's see. Well, so I do want them to see you this week. You can change the wound, you can change the dressing every day. You should change. I'll give you enough to bring, but leave it alone for for the day, so that we don't have disrupt the Celox. Then you want to change out that wound dressing. Yep, absolutely. Yeah. No, I'm checking to see. I haven't gotten a response from them yet. for when your appointment exactly would need to be. But, should be here. Should be here. Yeah, 3 weeks is a good time for follow-up because, like normally, but I just want them to see you first, and so they can watch the wound as it progresses, and see where it started, basically. I don't see anything here. Yeah, I mean, that is a new technique, hyperbaric oxygen, but yeah, you can do it. You can do that, but you don't have a hyperbaric oxygen chamber, do you? I wouldn't put honey on it, no. I know it's been used since ancient times, but I would, I don't know all of the different data on honey, and I do know that some wounds it slows down healing, although I know some wounds it improves healing. So unless you've done the research, I wouldn't. Always check that kind of stuff on pubmed.gov. I also really like Medscape. What other questions do you have for me while I check here? Okay. Okay. No, that should be fine. That should be just fine. That should be fine. Here, I think I got a message from them. Oh, so negative pressure wound therapy is if, like, you put a little thing on it that sucks away from it, helps to drain as well. Like on sometimes I've most experienced it with people post C-section for whom there's like a risk of endometritis. I've seen them have negative pressure wound packing on their wound. I've seen that. Yeah. I haven't seen it done always. I wish that I had spent more time. I always feel like it would have been nice to spend more time with surgeons because they know so much about wound healing. So, the stuff that I know is more, because my background is IRL, having done, some operational medicine. That's where my training background is. And then my, and then primary care. So that's where most of my background is. And then a sexual assault medical forensic examiner. So, and then a lot of behavioral health. So my specialties tend to be more related to like pain. Like I don't have a specialty. I'm a generalist, but where I have had the most practice has been really in things like pain, in behavioral health, and like especially a lot of women's health. A lot of sexual medicine for a lot of different issues for a lot of people. And that's kind of a lot of my area has been, while my, a lot of my training has focused on, I'm going to take these off now, because that's, yeah, so a lot of my training is like operational medicine type stuff, but I'm not, the people who really get down and dirty with that are your combat medics. So I've trained combat medics, but no, all my deployments were, my one deployment was, well, this glove is done. I think this glove has worn out its usefulness. Let me show you. This is your augmentin that you're going to take. This is my special, instead of a big pharma formulation, this is my formulation of augmentin for you. Okay? deal, right? Alright. I haven't gotten a message back yet, but I'll let you know. I'll let you know when we do. So if you want to just hang out in the area, we can continue on what we were doing. And we'll just kind of hang out and yeah. Alrighty.